I think that while a lot of people say that the fellowship application process is a numbers game and you really want to increase the denominator to increase your chances, I also just firmly believe that intention and conviction is 10 times more important than that. And having a direction of where you want to be will create a strong application, regardless of how many sites that you apply to.
Good evening, everyone. It's Vrushangi Shah with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I am thrilled to be joined by Madhu Nallani. Madhu, thank you so much for joining me today. And why don't you kick it off by telling our listeners a little bit about yourself?
Sure thing. Thank you so much for having me. So, my name is Madhulika, but I go by Madhu, and I'm originally from Maryland and raised in Laurel, Maryland in particular. I have grown up in Howard County, and then for college, I went to the University of Maryland and I studied biology there as well as women's studies. I was super involved in student government, clinical research, and really developed an interest in healthcare as well as healthcare leadership and advocacy. And so, with that, I decided to pursue an MHA at the University of Minnesota. Go Gophers! It's an amazing program, and it was so instrumental for me in really honing my skills in the field of healthcare management. And so now I am back in Maryland and I'm an administrative fellow at Luminis Health, which is based in Annapolis, Maryland.
That's incredible. And what a cool journey. You've obviously lived in the Midwest, you've lived on the East Coast. So I'm excited to kind of, dig into that. And of course, you're doing a fellowship, which is such a great opportunity. Why don't we take it a step back though? And I'd love for you to share some of your unique internship and graduate assistant, experiences that you've had. So I'd love for you to share with our listeners a little bit more about your grad research assistant position, the one that was related to health policy. What was that all about?
Oh my gosh. So, one thing about me that anyone will know is that I love health policy and I'm really fascinated by it because I think that whether it's at the federal or state level, policy really does influence behaviors, both when it comes to a person's behavior or health systems. And so I was really fascinated by how the federal or state level government interacts with private entities such as healthcare systems in particular. And so that's kind of how I got involved in that research assistantship. So the State Health Access Data Assistance Center is part of the University of Minnesota School of Public Health. And they are a phenomenal resource and almost like a research and consulting firm, so a two in one, that really helps states with technical data assistance needs. So that could be with regards to Medicaid and Medicare related information, and really ensuring that states are best equipped to understand their populations by really understanding the data that is provided to them. And so, in this capacity, I worked on some really cool projects. One in particular was I actually researched single payer legislation and how it could potentially be deployed in the state of Minnesota, because there were some talks on the state level legislative session about its potential. And it was really cool because single payer legislation is a bit controversial, but at the same time, it's a very unique way of approaching healthcare. And I got to learn so much about it by working in particular with Christina Worrell, who is a senior research fellow at SHADAC. And she has an amazing background in consulting that was then really leveraged well in this setting. And I also worked with Dr. Jean Abraham. She's now the head for the Division of Health Policy and Management at the School of Public Health at the U. And I really learned so much from the both of them and really understood just how important it is to craft policy in a really careful manner because it impacts so many people and so many systems.
Yeah, absolutely. And I did know that about you. And personally, I'm someone who has a huge interest in health policy. Even in undergrad, I did a lot of policy advocacy on Capitol Hill. And so 100% agree with everything you said, and I love that you're able to share that. I think another experience of yours that to me personally is very fascinating as someone who doesn't have a ton of experience in the consulting realm, but you had a federal management consulting internship at Guidehouse, I believe. So also share with our listeners, what that experience was like, what projects you did, and just any advice for someone trying to get into guidehouse or consulting in general.
For sure. First of all, I loved Guidehouse. I think the culture of Guidehouse and the investment of leadership into the intern and the internship program really spoke volumes about the values of the organization. So, Guidehouse, I really was interested in because they were based, or at least their headquarters is in Tyson's Corner, Virginia, which is basically in my backyard. And I was really interested in their federal management involvement because, again, I was so fascinated by federal policy. And so I got involved in their CMS account. So, as you know, in the consulting world, you have different accounts that you work in. And so I was posted to their Center for Medicare and Medicaid Services account. And with that in particular, I was tasked as an intern on their MIPS data validation and auditing project. So it was a very interesting task because it was a lot of that. Again, you're looking into validating data. And so it was very meticulous, at times a bit tedious, I won't lie, but it really ensured that I crafted a clear methodology for reviewing really important documentation that was going to either have a health system or provider be penalized or rewarded for their performance according to MIPS. And for those of you who don't know what MIPS is, it's the Medicare Merit Based Incentive Payment System program. And so I just thought it was a really cool experience working in consulting and kind of seeing how that process works, how a private corporation such as Guidehouse works closely with the federal government to ensure that certain protocols are being met.
Yeah, absolutely. It sounds like a very important experience, and I think internships and just internship type experiences are so important, especially in our graduate degree. So I'm glad you got two relatively diverse but very important experiences. And that kind of brings us to fellowship. So right off the bat, I want to learn a little bit more about, there's a lot of routes you could have taken. You could have gone consulting as well post graduate school. What drew you to the fellowship process? Was there something in particular that stood out for you?
That's a great question. I think it was working over the summer, and while I thoroughly enjoyed my consulting experience, I really did feel like I had so much to learn. I went directly into my grad school program straight out of undergrad. So with that, I didn't really have any years of work experience to understand what my particular passion might have been in healthcare, as well as where I felt like I could make an impact. And so the real reason why I wanted to pursue a fellowship was just knowing that there is an ocean out there with regards to just the world of healthcare. And I had to really immerse myself into it to know what it is I wanted to do. And I'm so, so grateful I made that decision because ultimately it did come down to one, going back to consulting or pushing myself and doing something a bit new, which was going the fellowship route. And I'm so glad I went that route.
Yeah, absolutely. Fellowships are extremely rewarding. I think I am, so I'll declare my biases, but also just, my support for fellowships. I think they're a great way to, get access, get exposure, but also figure out, your likes, your dislikes, because you don't know what you don't know. And I think grad schools at a high level will tell you what to anticipate, but fellowships give you the opportunity to really dig deep.
Yeah.
And so, kind of digging deep, if you will, into your specific journey for fellowships, can you tell our listeners, to the extent that you're comfortable sharing, just what the process was like for you, from the application all the way through interviews, how many did you apply for? What made you pick the sites that you were picking, and anything about the interview and application process that really stood out to you?
So, my fellowship application journey might be a bit atypical, and that's because I actually only applied to 3 fellowships.
Wow.
I was very, very particular, and I don't know if a lot of people would agree with my route, but I'm just going to lay it out because I think that while a lot of people say that the fellowship application process is a numbers game and you really want to increase the denominator to increase your chances, I also just firmly believe that intention and conviction is 10 times more important than that. And
Mhm.
having a direction of where you want to be will create a strong application regardless of how many sites that you apply to. And that's just my personal experience. So I'll kind of walk through what my thought process was. So again, it's summer 2023, and I know that I have this return offer to consulting, but I also know that I really want to explore the fellowship route. And so I was actually very transparent with my director at Guidehouse, who actually wrote one of my letters of recommendation for my fellowship application. And I explained to her that I have had an amazing summer, but I really do want to explore this route because I feel like there's a lot of opportunity here. And she was so supportive, and I'm so grateful for that. Again, speaking to the values of the organization and the people who run it. Now, going to my application, again, as you know, and as I've mentioned, I went to the University of Minnesota. So while it was an amazing process and journey of living in Minnesota and being away from home, I knew I wanted to be back home. My family is here, my community is here. I have just such a strong affinity for the DMV that I just knew I had to be back because I think that there's something so motivating about coming home to the community that you grew up in and then serving the people that have allowed you to have the journey that you've had. And so, on that very personal note, I felt like I had to just come back, and there was no ifs and buts about it. So with that, I was very, very particular about where I applied. Again, applied to 3 sites, Luminous being one of them. And I applied to sites where I really felt like I resonated with the mission, vision, and values. I wanted transparency with regards to what they were working on. I think knowing what initiatives a health system engages in is really telling of what they value. And so I really looked into all of those kind of aspects of a health system. And then I really, really was interested in direct mentorship from the CEO or C suite member. That was just no compromise there whatsoever. So, with that, I applied and I ended up getting 2 on site interviews. So, again, it's a gamble. If I was willing to take that risk because ultimately I knew I wanted to come home, and if consulting brought me home, cool. If a fellowship brought me home, also cool. But I went to 2 on-site interviews and ended up actually with 1 return offer. So 1 out of 3, and that one was Luminis Health. And it worked out amazingly. I am so grateful, and I do recognize how lucky I am to be in this position where I have a fellowship. But I think what I did in really ensuring that I had a strong application was speaking to what I could offer and what I knew about the Maryland community. And one thing I'll tell you is that Maryland, and going back to my love for health policy, has a very unique health policy landscape with the global budget revenue, which is essentially a cap on revenue that hospitals can obtain. And also this Maryland primary care program, which is this increased investment into primary care in order to increase access and improve health outcomes. And now, actually, just on Friday, it was signed into law, the CMS Ahead model in partnership with the Maryland Department of Health. So I was just really fascinated by what Maryland had to offer and its really unique population health initiatives that were in play, and thought, okay, this is an area that is going through a lot of innovation, and I want to be here. And I really think that helped me during my interviews.
Yeah, absolutely. So, what an incredible response. First of all, I know if I was a listener applying to fellowships, I already want to kind of recap some of the things that you said because it was so helpful. Well, first, I have to say that the DMV is a great area. So I definitely agree with you on that. I really enjoy visiting that part of the country. But, some of the things that I really want to kind of talk through again, you talked about having, your intention set from your application process. It's very evident that you were very mindful for where you applied. Obviously, service to others is a very big theme, and I think you said it correct. There is a big thought in the fellowship community that it's a numbers game. You should apply to 15 to 20, 30, as many as possible. And while I understand the logic behind that, because it's so competitive, I also want our listeners to really hone in on what you said, right? You don't want to just apply to places just to apply because it's going to increase your chances of getting a fellowship. For me, again, yes, I applied to 12, but originally I had a list of 24. And after sitting down with trusted family members, I realized that 12 of those I was applying to just to say I was applying. I had no real intention of wanting to live there. I had no real intention of connecting with that organization. So I think what I want our viewers to take away from this response of yours is, it is a place you're going to live. And so you don't just want to apply because oh my gosh, I'll get a fellowship. You should apply because you resonate, the mission, the vision resonates with you, and it's a place that you could see yourself living and potentially even settling down, because sometimes fellows, they do a fellowship and they stick around for a decade or more at that organization or in that city. So I just want to call that out, that this was such a good response on your end, and I appreciate you highlighting that. Um, and so now, digging deeper into your experience at Luminous Health, tell our listeners first the logistical piece of this fellowship, right? So, what is the format of the fellowship? Is it project based? Is it more rotation based? Do you have co-fellows? Is it 1 year? Is it 2 year? Kind of what? Can you set the stage for this specific fellowship, please?
For sure. I'd love to set the stage. So, the Luminis Health Administrative Fellowship is a 1 year project based program. The preceptor for the program is the CEO of the health system, Tori Bayless, who was actually a administrative fellow herself back in the day. So she really knows the value of what this fellowship and what fellowships in general can offer.
Sure.
And then the two other preceptors are the two hospital presidents within the health system. So there's Sherry Perkins, who is the president of the Anne Arundel Medical Center and is my preceptor. And then there's Deneen Richmond, who is the president of the Doctors Community Medical Center. And she is the preceptor for my co fellow, who is a GWMHA alum. So this program really requires you to take initiative, as with any sort of project based fellowship program. You really have to do your research and understanding of what's happening, but it comes pretty easy in the sense that as a fellow, we really have the privilege of knowing a lot of what happens. So I'll just kind of walk you through key meetings that we sit through on a given week. First, we start every Monday morning with the Luminis Health Hospital Executive Committee. So we are a two hospital health system, and with that comes a lot of integration efforts that are needed to ensure that we kind of have these standardized processes in place while also respecting our localized, unique entities that are, again, Anne Arundel and Doctors Community Medical Center. So we started the morning with that, and it's led by the two hospital presidents as well as the COO, who we actually have an overarching COO for the two hospitals, as well as the CMOs and CNOs, as well as the administrative fellows. Then that afternoon, we actually spend time with the Luminous Health CEO Council, which is again the C suite executive leadership office.
Sure.
And what we do is Tori will facilitate that meeting, and it will basically be an opportunity for all of us to provide updates on what we're working on. And yes, that includes fellows. She wants to know what we're working on. And so we kind of start out by naming good things that are happening. We go into lightning round updates, and then we go into the more formal presentation of what's happening across the system. What do we need to keep in mind? Other than that, we have on a monthly cadence the All Luminous Leadership Council, which is a 2 to 300 person meeting of senior leaders across the entire health system. And my co fellow and I actually present at that meeting on a monthly basis about the True North metrics, which are essentially our guiding metrics that will allow for us to achieve the progress and the certain targets that we want to. We
Yeah.
also have the Luminis Health Executive Leadership Council, which meets on a quarterly basis. So I could keep listing really cool meetings we get to sit in on. But the fact of the matter is that we get a lot of exposure to not only leaders, but to initiatives that are happening.
Sure.
Some cool initiatives that we're seeing right now is the implementation of UKG as the new human resources and payroll platform. And that is a tremendous initiative that's happening right now. And I have the utmost respect for our HR, IT, and finance team that's really putting that together. Additionally, at the Anne Arundel Medical Center, we're doing a lot of occupancy management and hospital throughput work that I actually get to be a part of, which has been really, really great. And it's really developed my love for hospital medicine operations. So there's so many things happening across the system that we get to sit in on and as along with that be engaged in.
Yeah, absolutely. And it seems like mentorship is a big part of the fellowship. And I know a lot of fellows actually do specific fellowships or go to specific health systems because of how well they can be mentored by senior leadership. And so I know you talked about all the meetings that you and your co-fellow get to sit on, or the things you guys get to do in the fellowship itself. Can you also work on projects together, or do fellows kind of go their separate ways after the first couple months?
Yeah, that's a good point. So, my co-fellow and I definitely interact on a daily basis with regards to a lot of things. We actually send out a weekly report of key drivers or key metrics that we need to keep in mind in both hospitals. And so that data management is an integral part. Again, the True North metrics that we report on a monthly basis, we collaborate on. But with regards to more maybe strategic or operational projects, one thing that we've actually been working on together is potentially looking into a hospital at home work plan and how that could be deployed. And it's really required us to think about the research and the different aspects of how do you make this logistically possible. And there's so
Yeah.
many benefits to it, but we've done some lit review so far, as well as talk to our preceptor, the CEO, on a weekly basis about what that could entail. And so I think it's definitely what you make of it. My co-fellow and I, what I really enjoy is that we come together in many ways and have many strengths that come together, but we also have our own unique interests that we're kind of falling into. And so I really appreciate the fact that the fellowship provides us that space to flourish on our own while also really emphasizing the fact that healthcare is a team effort. And so
Mhm.
you should know how to be a team player. And that's why I'm so glad I have a co-fellow in this process.
Yeah, absolutely. Healthcare is so big on teams. And I do think that having one or more co fellows does make the process a little bit easier because, regardless of the organization that you're a part of, if you have a co fellow or a cohort of fellows, you can be doing your own things. But at the same time, you kind of have a safe space and a home base to go to, someone who's kind of experiencing similar things and can really be a thought partner for the fellowship experience. And of course, when it comes to recruitment, it's always helpful to have more than one person.
Tell
um,
me about it. Oh my gosh.
we joke, in the fellowship cycle, that your first job as a fellow is literally hiring your replacement. And so, super helpful when there's two or more people working. Because I think, not to get too much into it, but recruitment for fellows is a whole other process. And there's a lot of logistics and moving pieces to get the right people on site and finally find the fellow for the following year.
Oh my gosh. I will say that that process taught me so much about change management and the value of being nimble.
Yeah.
You really have to just expect the unexpected and take it in full stride and just keep moving. I mean, it is such a meaningful lesson that you learn through that process of building the application portal and then starting to welcome those people, and it was such a great process, and I'm so happy with the two fellows we've selected, and in general I've just learned so much through it.
Yeah, absolutely, absolutely. And so I think kind of building off of that, not so much the recruitment process, but when you look back at your fellowship process, of course you did well, you were successful in securing a fellowship, and more importantly, a fellowship kind of in the home state or the place where you wanted to live. To our listeners, what's one thing if you looked back on the fellowship cycle that you want future candidates to be mindful of, or something that maybe you would redo if you had the chance again?
I would say I would just remember to trust the process and remember that everything happens for a reason. Those
Yeah.
rejections that I received, it was definitely defeating because I put my all into it, right? It might have been 3 applications, and I get that, it was only 3. However, in those 3, I put a lot of time, blood, sweat, and tears, if I may say, into them. So, when you fly halfway across the country to do that final round interview and it doesn't end up the way you thought it would, and you did phenomenally and you think it was received well, but there are other factors in play that you just can't help, it makes you question, what you have to offer. But throughout this process of applying to fellowship sites, I have met the most incredibly talented, kind, and brilliant people. And so I'm also reminding myself that in the process of flying out to these sites, I met people who I hope will be in my network in the long run. And I have the utmost respect for them. And even if things happened not in my way or in the Luminous case that happened in my favor, just remembering that there's a path for everyone. And it's just a matter of how it will happen, not if it will happen, because everyone is destined for something big and something good. It's just a matter of what exactly that path will include. And I just wish I could tell myself a year ago, like, you're going to be fine. You're going to be just fine. And you will be on cloud nine having the most amazing fellowship experience, the things I've learned, the growth I've experienced in just 4 short months, coming up on 5 now, actually. I'm just so blown away, and I have no words to express my gratitude for this opportunity.
Yeah, absolutely. And again, just incredible advice on your part. I think I'm also a big believer in like everything, works out, and the whole notion of what's meant for you will find you. And I think you have to trust the process when it comes to the fellowship cycle, because it is an emotional roller coaster and you will drive yourself insane if you even spend too much time on LinkedIn watching other people upload their updates. Sometimes it's good to step away,
Yeah.
and just take a break. But no, incredible advice. And I always like to ask my guests kind of like a fun question. Fellows will oftentimes move cross country or halfway across the country to join a health system. And so, what is something about the DMV that you absolutely love? What is something that maybe someone who's never been there or never lived there should know? Should they be considering that area, and should they be considering Luminous?
Oh my gosh. So, if I had to pick, you have to give me 3 things to say, though. I just can't pick
Go
one.
for it.
Because the DMV is humongous. Again, for those of you who don't know, it's DC, Maryland, Virginia, right? So very unique identities. I'm a Marylander, so I am very passionate about just the good old Annapolis area. I have grown to just love, love, love Annapolis. I think it's such a charming city. It's the capital of Maryland. And I have just really grown to love what it has to offer, what it means to me, my family, the community, especially working at the Anne Arundel Medical Center. It's such a staple in that area. I love Annapolis, and you have to check it out. Now, if you're more so on the DC side, then you can't go wrong with a DC brunch. I love a good DC brunch. There's always a saying that when you're at brunch in DC, no one is sitting down, they're always on their feet dancing. And it's just such a fun, fun time. And then lastly, so I'm a trained dancer. I've trained in an Indian classical dance form called Bharatanatyam. And I also take workshops and explore different styles of dance across the DMV. And so even if you're not a trained dancer, you don't have to be, But just get up and try something new. And it could be a salsa class, it could be a Bollywood fusion class, it could be whatever. I just think that the dance community here is thriving. It's amazing. The culture that they've fostered is phenomenal, and I cannot recommend it enough.
Yeah, I love that. I love that. I am a big fan of DC. I love the Georgetown area, or even just as cheesy as it sounds, walking across Capitol Hill, or going to the Lincoln Memorial, which is my favorite monument, which is so nerdy. I realize having a favorite monument. But I think, very underrated, and I do love DC. And then to your last point, I also trained in dance, and so I love that you highlighted that there is something for everyone, and keeping an open mind and trying new things, even if you're not a trained dancer. um,
Absolutely. Anybody can dance. I firmly believe in that.
Yes, absolutely. I would agree with that. Those are the only questions that I have. But Madhu, I just want to say thank you so much. A huge portion of this podcast is bringing people early in their fellowship, almost done with their fellowship, or a year out of their fellowship, to really highlight, different organizations, different perspectives. And I really enjoyed having you on the episode today. And I genuinely believe that the advice that you gave specifically for, the fellowship cycle and picking your sites, but then also about, the one of the last questions I asked you about trusting the process, will really resonate and help a lot of our listeners. So thank you again for joining me tonight.
Thank you so much. I just want to say I think this platform is awesome. I'm so appreciative of the work that you're doing and the entire team is doing to really foster these conversations. Administrative fellowships are invaluable, and I really hope that we can really show people how to put their best foot forward as they apply to them and as they also take part in one. So, thank you so much.